Greetings, ladies and gentlemen. First of all, let me thank the God Almighty for giving us the chance to present our student project in today's occasions. But first of all, before we get into the presentation itself, please allow us to introduce the member of our small group discussion. Next. So here are the groups of our small group discussion. Next. In this presentation, we will provide an explanation of our student project with the theme of best practice in pre-analytic histology specimen handling, a comprehensive review. And here we will be covering some parts of our student project, which will include the abstract, introduction, the literature review itself, which consists of specimen collection, specimen fixation, specimen processing, sectioning, staining, storage, and also quality control. And next we will covering about the conclusions and also the reference for our last explanations. So without further delay, let me invite my colleague to start the presentation itself. Please, Nadira.
My name is Nadira, and I will explain about abstract. So the pre-analytical stage of laboratory examinations play a crucial part in obtaining precise and accurate test results, especially in examining tissue specimens. To achieve accurate information, there are some aspects to be paid attention to. In the paper, writer discussed how to handle histological laboratory specimen in the pre-analytical phase, starting with collecting the specimen by biopsy. Then the specimen undergoes process like fixation, sectioning, and staining. Lastly, in every step of pre-analytical examination, there must be a quality control to ensure tissue value. Afterward, the right diagnosis will be achieved for the analytical phase. Next.
Hello, my name is Pururaswini Athiyah. My number is 202-511161. The introduction is, in general, laboratory examination analysis is divided into two: pre-analytical, analytical, and post-analytical. And the pre-analytical is one of the most important stages. It is because this stage will constantly affect the next stage, analytical and post-analytical. Therefore, the best technique is needed in carrying out the analytical procedure.
Hello everyone, my name is Cendrawan Han Santoso and my number is 170. And specimen collection. There are a few types of specimen collection. The first one is needle biopsy, which is done by inserting a needle through the skin. It is usually done to access areas near surface of the skin. Number two is endoscopic biopsy, which is done with the help of an endoscope, usually for gastrointestinal or urinary system. Next is skin biopsy, which is taken from the skin, and it usually depends on the extent and requirement of the area affected. Number four is bone marrow biopsy, which is done through the bone marrow, usually from the hip bone, and is usually done to diagnose blood problems. And the last one is surgical biopsy, which is done through surgery, usually when other methods are not suitable or results are inconclusive.
Okay, hello everyone. My name is Yanti Graciella, and my last three-digit NIM number is 162. And I will explain the specimen processing. First, obtain the fresh specimen. Fresh tissue specimen are easy to obtain, but should be noted that they are very easy to damage. Two, fixation. Fixation is used to harden the tissue, prevent autolysis, and improve cell avidity for special stains. Three, dehydration. Dehydration is did because the paraffin is wax. Paraffin wax is hydrophobic. That means cannot mix with water. The next one is clearing. Clearing is have to done because even though the current tissue is basically free of water, in reality the wax insertion process will still difficult. 5, wax infiltration. It done with melted wax at temperature less than 60 degrees Celsius in order to avoid molecular damage. 6. Embedding or blocking out. The specimen is have to be formed into blocks that can be clamped into the microtome.
Hello everyone, my name is Zulfikar. So I'm going to explain about specimen fixation. What is specimen fixation? Specimen fixation is a process by which internal and external structures of specimens are preserved and fixed in position. There are 6 common methods of specimen fixation, such as chemical fixation, heat fixation, freeze fixation, ethanol and methanol fixation, acetone fixation, and formalin fixation. Next. So chemical fixation. Chemical fixation is the preservation of cellular and tissue structure for biological samples. It's frequently accomplished through chemical fixation. Chemical fixation is technique to fix the specimen using chemical agents such as aldehydes, like formaldehyde, acrolein, glutaraldehyde, coagulants such as methyl alcohol, ethyl alcohol, acetic acid, and oxidizing agents such as osmium tetroxide.
Okay, I will continue. Our heat fixation is usually done to observe bacteria and viruses. A film of cells is smeared and is gently heated as a slide is passed through the flame. Heat fixation can preserve overall morphology of the cells and inactivate bacterial and viral pathogens. Next. For freeze fixation, it refers to the quick freezing of small specimens and is followed by vapor fixation at a low temperature. Freeze fixation is different to freeze drying method by not removing the water of specimen before fixation and different to freeze substitution by not replacing water during fixation. Next.
Hello everyone, let me introduce myself. My name is Patricia Orlyn Jotan with the last 3 student number 171. Ethanol and methanol fixation. Ethanol and methanol fixation begins respectively at 50 to 60% concentration and greater than 80% concentration. They are well recognized to be coagulants than in nature proteins. By substituting water in the tissue environment, they disrupt hydrophobic and hydrogen bonds, changing the tertiary structure. Although ethanol misrepresents both cytoplasmic and nuclear features, it can occasionally be employed to preserve glycogen. Methanol is more frequently employed to fix blood pills and exfoliative cytology smears. The next one is acetone fixation. Another fixative used in histopathology is acetone. It works as an effective lipid solvent that makes tissue fragile. They also typically utilized as a dehydrating agent in tissue processing. In addition to tissue fixation, they are suggested for use in automatic tissue processor due to their extremely volatile and combustible character. The next slide will be presented by my friends. Thank you.
Okay, so the last one is formalin fixation. Formalin fixation is the most frequently used fixation because it prevents autolysis and stabilizes the tissue by cross-linking with amino groups of amino acids found in peptides and proteins. Other things such as nucleic acid, carbohydrates, and lipids are not degraded during the formalin fixation process. The three-dimensional structure is additionally kept so that it can be analyzed. Next.
Okay, thank you very much. Let me introduce myself. My name is Wildan Mahsyar. My last number is 174, so we know at sectioning. Sectioning is a step of cutting tissue specimens into thin slices in histopathology examination. This process aims to cut 4 to 5 micrometer thick of tissue. Basically, this purpose is achieved by using high-precision knives called a microtome. Specimen needs to be cut into specific thickness, preferably 4 to 5 micrometers, so it can be stained and put on a microscope slide. There are two main categories of sectioning, paraffin and fluorescent sectioning. Next, please. Okay. Paraffin sectioning. Tissue specimen that has been dehydrated, infiltrated with wax, and embedded in wax are being cut on a microtome into thin slices. This cutting procedure is called paraffin sectioning. Paraffin sectioning are relatively more physically stable and superior to fluorescent sections in terms of maintaining tissue morphology with less damage. However, paraffin sections are not very optimal for some staining process due to rock infiltration into the tissue specimen. Next. Frozen sectioning. Frozen sectioning is a procedure of cutting frozen tissue into thin sections. This procedure is conducted in a closed state, basically a microcosm that is housed in a low temperature chamber. Frozen sectioning is also a common method for historical preservation of lipids in tissues, as the frozen sectioning extracts lipid from cell. Thank you. Next.
Hello, my name is Michelle and I will explain about staining. Staining is a process of clarifying a part so that a tissue element is produced that looks much clearer under a microscope. There are two kinds of staining on tissues, namely routine staining and also spatial staining. The most commonly used routine stain in histopathology is hematoxylin eosin. Hematoxylin causes a clot to appear bluish because hematoxylin is alkaline and specifically colors acidic cell elements. Cell elements that will appear blue are the core, DNA and RNA, and the cytoplasm, which contains lots of ribosomes. This area is called basophilic. Meanwhile, eosin will cause a cell to appear pink in color because eosin is acidic and specifically color cells elements that are alkaline. Cell elements that appear pink are the mitochondria, secretory granules, and collagen. This area is called acidophilic or eosinophilic. In order to produce the best staining results, it requires materials and procedures that are carried out properly. Thank you. Next.
Hello everyone, my name is Dea and I will explain about the storing of the histological specimens. After proper sampling and diagnosis, samples for routine histological examination are preserved in a column of 10% neutral buffered formalin that is at least 20 times the volume of the specimen. Do not place specimen for immunofluorescence, frozen sectioning, or histology in formalin. All the specimen in formalin should not be refrigerated, as this will adversely affect fixation and adversely affect tissue preservation. Paraffin blocks and slides should be stored in a non-humidity room below 27 degrees Celsius or at room temperature with proper pest control. Make sure to keep it away from direct sunlight. Refrigerated storage at 4 degrees Celsius has also been shown to improve staining quality and is suggested. However, it has not been proven to be superior and is not practical in routine laboratory setups.
And for the quality control, a good laboratory system and procedure is integrated with safety protocol and quality control in order to prevent dangerous outbreak while providing an accurate information required to produce a diagnosis. Hence why quality control is necessary to every laboratory procedure in every knowledge division, including histopathology. Next. The pre-analytical phase in histology specimen handling consists of a few systematic processes which aim to prepare the specimen and the required raw information for further testing and resulting in diagnosis. This process is done by a few laboratory workers, which eventually will create a potential risk of laboratory error. A study in the past proved that an error in the pre-analytical phase of histology specimen handling could result in diagnosis inaccuracy, which also had a fatal impact on 50% of the patients diagnosed with a false result. Next. And there are some forms of the quality control in many categories of procedure. First, there's the category of sample collection, and then there's tissue processing and embedding, referral form, cutting of sections, session and labeling, staining, cross analysis, and equipment. Next.
Hello, my name is Adellya, and my last 3-digit number is 165. Conclusion: pre-analytical histology specimen handling steps, including collection, processing, fixation, sectioning, staining, and storing must be performed properly according to laboratory quality control guidelines to obtain a good sample for testing. Targeted surface of the body, adequate quantity of the specimen, the kind of staining, also sufficient storing time and spaces need to be considered. The quality control itself is used to detract errors during examination. Low error rate on examination increase the chances of a precise diagnosis, so it can lessen the fatal impact on the patient related to their therapy.
And that's all for our student project presentations. I thank you for all the watchers and the viewers, and apology if there is any mistakes were made in our side. Just once again, thank you and goodbye.